Physiology of sleep and wakefulness. Chapter 1. Sleep duration and variability. Most adults require 7 to 9 hours of sleep per night for optimal health. Sleep patterns vary by culture. In the Fadus, adults typically sleep in one consolidated episode at night. In some cultures, sleep is divided into a mid-afternoon nap and a shorter night sleep. Sleep patterns change with age. Infants and young children sleep more than adults. Individuals, 70 years, sleep about an hour less at the morning than young adults. 2. Sleep stages and polysomnography. Sleep stages are classified based on BAWA, EEG, brainwaves, EOG, eye movements, and EMG, muscle activity. Polysomnography, continuous recording of these parameters to study sleep. Warbel-Torchi, 2 basic sleep states. 1. Non-rapid eye movement, NREM, sleep. Subdivided into 3 stages, N1, N2, N3. Progressively deeper sleep with a slower EEG activity and higher arousal thresholds. N3, slow wave sleep, is the deepest and most restorative. 2. Rapid eye movement, REM, sleep. EEG similar to N1 sleep, with on low amplitude mixed frequency activity. Muscle paralysis except respiratory muscles, due to brainstem mediated inhibition associated with dreaming. 3. Sleep organization. Sleep typically follows a Chi Ber, predictable pattern of Chi. Each night, sleep progresses from NREM, N1, N2, N3, REM in cycles. The first REM episode occurs in the second hour of sleep. REM and REM sleep alternate. Every 90-110 minutes. Ultradian cycle. Distribution of sleep stages. REM sleep, 20-25% of total sleep. NREM, N1 plus N2, 50-60%. N3 sleep, deep sleep, 15-25%, decreases with age. ZURM, effects of age on sleep. N3 sleep decreases up with age and may disappear in older adults. Older adults have more frequent awakenings, but do not struggle to fall asleep. REM sleep is 50% of total sleep in infants, but declines to 25% in adults. Effects of sleep deprivation. Cognitive performance declines, particularly affecting vigilance and reaction time. Older adults are less affected by sleep deprivation than young adults. Sleep debt recovery. NREM, sleep recovers first, followed by REM sleep. REM sleep deprivation, e.g. waking up early, leads to REM rebound, earlier onset of REM. Health consequences of sleep deficiency. Increased risk of diabetes, obesity, metabolic syndrome, immune dysfunction, cardiovascular disease, cognitive impairment, Alzheimer's, and stroke. The National Academy of Medicine has labeled sleep disorders an unmet public health problem. 5. Neural regulation of wakefulness and sleep. Wakefulness and sleep are controlled by specific brain circuits. Ascending arousal system activates the cortex, thalamus, and forebrain, using neurotransmitters like norepinephrine, dopamine, serotonin, histamine, glutamate, and acetylcholine. Orexin, hypocretin, from the hypothalamus reinforces wakefulness. Brain lesions and sleep disorders. Damage to the rostral pons, lower midbrain, coma. Damage to the hypothalamic arousal system, excessive sleepiness. Loss of orexin neurons, narcolepsy. Thalamic injury, persistent vegetative state. Preserved sleep-wake cycles, but loss of conscious awareness. Sleep-promoting system. Neurons in the preoptic area and pons inhibit wake-promoting areas via GABA mast, melanin-concentrating hormone, MCH. Neurons in the lateral hypothalamus promote REM sleep. mutual inhibition between arousal and sleep-promoting neurons. Functions like a Wolf flip-flop switch, ensuring rapid transitions between sleep and wakefulness. Dowa, REM sleep regulation. GABAergic REM-off neurons. In the midbrain inhibit REM-on neurons. In the pons, REM-on neurons. Inhibit motor neurons, causing paralysis. Stimulate dreaming regions in the forebrain. Cholinergic input promotes REM sleep, while norepinephrine and serotonin inhibited. REM sleep behavior disorder, RBD, occurs when REM paralysis is lost, causing people to act out their dreams. Mantis. 6. Regulation of sleep-wake cycles. Homeostatic sleep drive. Prolonged wakefulness, increased sleep drive. Adenosine accumulates in the brain, inhibiting wakefulness, blocked by caffeine. Other molecules like prostaglandin D2 also promote sleep. B. Allostatic regulation stress-related changes. Stress overrides normal sleep drive, leading to insomnia, anxiety disorders and chronic stress. Increase arousal system activity, making sleep difficult. Cognitive behavioral therapy, CBT, is often more effective than medications for treating insomnia. C. Circadian rhythm regulation. The suprachiasmatic nucleus, SCN. In the hypothalamus acts as the body's internal clock. SCN receives light signals from the retina and controls 24-hour rhythms of sleep, hormone release, and body temperature. Melatonin secretion is regulated by the SCN and suppressed by light. Circadian misalignment, e.g. shift work, jet lag, causes insomnia and cognitive impairment. Bauer-Hand. 7. Physiological changes during sleep. A. Brain activity and dreaming. Memory formation is inhibited at the onset of N1 sleep. REM sleep is associated with vivid dreaming, sleepwalking, night terrors, and bedwetting, enuresis. Occur in deep NREM, N3 sleep, mainly in children. REM sleep behavior disorder, RBD, occurs when people act out their dreams due to a lack of paralysis. B. Cardiovascular and respiratory changes. And REM, sleep, blood pressure and heart rate, decrease. REM sleep, large variations in blood pressure and heart rate occur. Breathing becomes irregular. During REM sleep, solve 1 force C, brain detoxification and Alzheimer's risk. During sleep, the eye extracellular space in the brain expands, allowing of amyloid clearance SOL via cerebrospinal fluid. Poor sleep is linked to Alzheimer's disease due to accumulation of V amyloid. D. Endocrine and temperature regulation. Growth hormone. Secretion peaks during N3 sleep. Melatonin. Secretion follows the circadian rhythm and promotes sleep. Body temperature drops during NREM sleep and is not regulated during REM sleep. Key takeaways for exams. 1. Sleep stages. NREM, N1, N2, N3, and REM. 2. Sleep cycles. Alternating. NREM, REM cycles. 90 min each. 3. Brain circuits. Arousal system. Uses orexin monoamines.